I have spent many hours sitting there with crying patients. I'm ugly. My husband doesn't find me beautiful anymore. I don't feel like a woman anymore. Um, and we're getting there. We have an end goal, but it takes a while. It takes months sometimes, depending on how they're healing. And they, I, you know, I bring the husbands in and they're like, I don't feel that way. But their partner, who is probably the most honest person with them, the woman doesn't believe because they feel like they have to say that, just like your daughter. And you're being honest with them. And at the same time, I challenge my patients, okay, go to the grocery store. Tell me how many women there don't have breasts. And they're like, well, I don't know. And I'm like, exactly. They don't know either. The checkout person didn't know if you had breasts or not. They were worrying about, why is she buying these weird things? Like, they're not thinking about that. Or maybe they're thinking, I can't wait to go home.
Welcome to the Clear Skin Chronicles, the podcast that takes you on a journey to uncover the secrets of achieving glowing, acne-free skin. We believe that knowledge is power, and by understanding the root causes of your acne, we can create a solid foundation for long-lasting clear skin. I'm Katie Stewart, registered holistic nutritionist and founder of the Clear Skin Solution, where we help women just like you get to the root cause of their acne.
And I'm Chris Brown, registered holistic nutritionist and program director in the Clear Skin Solution. Through functional testing, we pinpoint where the body system imbalances lie so we can dive deep into your acne clearing journey.
We work virtually with clients to clear up their skin from the inside out and have helped thousands of women worldwide regain their confidence. So we have a very big topic today here on the Clear Skin Chronicles. And, it's a topic that you can't really get away from, especially with what Chris and I do. We work in the skin world. We're dealing with acne and we're dealing with clients, and the majority of our client base are millennials, and millennials are the ones that, even millennials and younger, you're seeing that rise of plastic surgery, the rise of Botox and the fillers and the breast augmentation. So when I first talked to our guest today, Dr. Aaron, I was a little at the first, to be honest, I was a little apprehensive. I'm like, oh no, this is a big topic. I usually like to stay away from those really hotly debated topics, but I feel like we would be doing a disservice to not only our clients, but our community at large if we didn't talk about these things, because it is so prevalent in our society. So today we're digging into all of that, Botox in this health conscious world we live in, the plastic surgery, and all of the fun things that come along. So today we have the lovely Dr. Aaron Gilson. He is an aesthetic fellowship trained and board certified plastic and reconstructive surgeon, and his office, Gilson Plastic Surgery, is located in Portland, Oregon. So he's coming to us all the way from Oregon while we're up here in Ontario. And Dr. Aaron, you really focus on the aesthetics of the face, body, and the breast. So what I really love about you is you're known for that patient-centric approach, right? You're combining the surgical and the non-surgical techniques. And what really caught my attention when we first connected is you talked about the importance of diet, and you talked about how you actually spend more time saying no to your clients than you do saying yes. And I think this is a really good stance to take, because in that society that we live in, plastic surgery is everywhere. Like, you open up your phone, you scroll, it's all in the phone. You go on a television show, it's everywhere. So I would love to really just get your unfiltered opinion on the plastic surgery that's going on right now.
Yeah, absolutely. First, thank you for having me on the show. Also, if you ever want to just come to my office and be my hype man, that would be awesome.
Amazing. I'm good at being a hype man.
She's really good. Yeah.
I mean, you're so right, though. Plastic surgery is kind of the catch-all for anything aesthetic, and different portions of the industry kind of lean back on plastic surgery. And there's a huge umbrella that we cover. And the origins of plastic surgery were reconstructive surgery for people who had debilitating diseases or traumatic injuries. And it goes back to the, medieval times, the first kind of plastic surgery procedures. And the 19th century or 18th century and 20th century have really been the glory days of plastic surgery. And that's been kind of the start of the cosmetic surgery craze. And that's when you start getting Botox and fillers. I mean, Botox didn't start till 1970, and it wasn't even approved for cosmetic until 2002, which seems like it was just yesterday, right? I mean, you think of Botox as being this really old thing, and it has been around forever. But you're right. The media in general puts so much emphasis on beauty, and we as a society place so much emphasis on beauty. We celebrate people who we think are beautiful. We put them on billboards. We put them in movies. Now you have a mobile advertising device that you carry around and look at all the time, and everyone's advertising to you. Your friends are advertising to you. You are advertising to yourself and to your friends about lifestyle choices. And um, I I don't, I pay attention to skincare because it's the industry I'm in. But if I wasn't in plastic surgery, I wouldn't even think of skincare. But I could probably name 10 common brands of skincare off the top of my head, having no experience with any of them. But it's just because we're so inundated with this idea that in order to be a successful person, you need to have perfect skin, perfect teeth, perfect hair, and perfect body parts. And I'm getting, I always get a little heated over societal's influence on the person, because you don't need that. Just live your life. But with plastic surgery, it's been kind of a game changer in allowing people to change or augment the parts of their body that maybe they have self-confidence issues about, or one of the big things I do is a lot of breast reconstruction. So breast cancer patients who have had mastectomies where they've lost part of their bodies, we're able to restore those parts of bodies. And a lot of the training and education goes into breast augmentation or breast enhancement for postpartum women who just don't identify as feminine after having their children. There's nothing wrong with that. That's very natural. But and that also extends into the Botox and cosmetic filler facial kind of world too.
It's interesting, right? Because I feel like in our society, we kind of walk that fine line between the industry preying on vanity, and then the other side of that same coin is helping individuals feel better about themselves. And as a doctor, how do you approach that? Like, how do you walk that line of people that are coming in that are being preyed on by social media, and they come and they're like, I need all of these CCs in my lips, and I need this, and I need that, and then they don't even look like themselves. But then there are those clients that come in that have those like deep rooted things that are impacting their confidence. So how do you as a doctor approach that really, really delicate line?
Yeah, I mean, it's tough. You have 4 years of medical school, and I think in one episode you guys were talking about the amount of nutritional training that physicians get. And I looked because I was like, man, I feel like I got a lot more than 7 hours. And I don't know how much I got, but in just the 4 years of medical school, I think the US says you should get 25. Most schools are averaging around 19, which a lot of that is on the building blocks in the Krebs cycle. So it's like really deep nutrition. It's not kind of high level things in body enhancement. And so all of those aspects, I got, maybe 20 hours of psychology in medical school. So I'm not a psychiatrist. I'm not a psychologist, but a lot of the patients who come into me, we're kind of navigating those issues, making sure there's no body dysmorphia components, because I can't treat body dysmorphia with plastic surgery. In fact, that's the opposite of what that person needs. And take a picture of yourself with your phone, or look at yourself. Like, I think a good test to do is ask someone to look at themselves. Someone who's at the upper end of the millennial spectrum, the older age, will go find a mirror. Someone who's at the younger age will turn their selfie phone on, their camera mode. And to me, it's mind-boggling because I'm on the upper end and I don't really think of doing that. And I asked a friend something, and they, used their phone. I was like, what made you think to do that? And so the other day I had a patient come into me, beautiful young woman, early 20s. She, great physical shape, and she felt that her face was asymmetric, and she came into me for filler. And I mean, I look at faces all day, every day, and I think about everyone's flaws all day, every day. And I don't tell them, but I look at them
It's
because,
part of your job, right?
yeah.
Mhm.
I'm going to put my filter on now. No.
Chris is like, we're all like, oh my
Right.
God, what is he seeing?
Um,
Filter. Speaking of the phone.
yeah, but so I asked her, like, how do you look at yourself? And she said, with my phone. And it's like, what do you think is different about yourself? And she named some things. And I talked to her about the optics of lenses. So your selfie lens is designed to show a lot of space around you. So what it does is it elongates the nose, it brings the cheeks back. Sometimes your chin, depending where it is, can make it bigger or smaller. So that lens distorts everything. And then you go to Instagram, and the people you notice with who have had lip filler on Instagram are people who have had a lot of lip filler, or people in your life. And so you start to, over time, internalize this as this is beautiful. People with big lips, or people that have had gluteal augmentation, you see that and you say, oh, this is what beauty is. It's not beautiful. It's just what we have internalized as part of society. So those patients come into me and we have to have that long discussion about, I am not putting 2 cc's of filler into your lips because it is not beautiful and it's not healthy. There's nothing wrong with putting filler in your lips if that's what you want to do, but you need to do it safely without increasing your risk. That is in a way that is congruent with natural beauty. In my practice, I try to be as natural looking as possible with my results. You know, the worst compliment you can ever get as a plastic surgeon, in my opinion, is who did your plastic surgery? It looks great.
Ooh.
They should never ask that. They should be like, did you change your skincare regimen? Are you sleeping better? What gym are you going to? That's a
Interesting.
good compliment.
Mhm. That's true,
So,
right? It's so interesting. I was watching a reality show recently, and one of the contestants had obvious plastic surgery where like her lips were half the size of her face, and her breasts were so large, like, and her frame was so tiny, and you could
yeah.
tell she had a gluteal augmentation as well, and like it just looks so disproportionate. And like I never want to judge anybody because I understand people have these deep rooted issues with themselves and their confidence. And on the other hand, it's like I do feel just so bad that our society has conditioned women and even men and individuals to feel like they need to have these things in order to be looked at as beautiful.
hmm And
Yeah.
it's in every industry. I mean, the gym industry, same thing.
Hmm.
Um, they advertise putting pictures of ripped men and women on Instagram and things like that, and that going to the gym is healthy until it's not. And there are
Hmm.
a lot of things in life that are healthy until it's not. You can eat a certain way that's healthy until you become obsessive about your diet in a way that is unhealthy. And that can be a very, very fine line for some
Hmm.
people. You know, avoiding one food group in one group of people is fantastic. Avoiding in another can lead to bad
Hmm.
circumstances. And that's why it's always good to come to, you know, professionals like you guys. I don't know enough about the wide world of food. I mean, I was listening to some of your health struggles and how you guys kind of navigated those, and I was blown away. I was like, that's not my area expertise. I would never think to do some of those things. And food, I talk to my patients about diet and exercise and appropriate diets all the time, but my scope of practice is like this. And then you guys are there with, you can't see it, but there's a lot of
Thanks,
room.
Dr. Aaron. We appreciate
Yeah.
it.
That I
And
don't know.
I'm so glad you brought that up. And I'm so thankful that, I feel like this next generation of doctors are really putting a more emphasis on the importance of diet and lifestyle when it
Yeah.
comes to your health, right? It really was that old school mentality that, oh no, diet has nothing to do with how you're feeling internally, but it's like, trying to pour diesel into a gasoline engine and hoping that it runs well. So I really appreciate, you you kind of seeing that from a doctor's perspective and hearing that from the doctor, like for Chris and I, it feels good because, there's lots of doctors out there that still fight us on the fact that, oh no, what you eat has nothing to do with the fact that you've had chronic acne for 20 years. You just need Accutane. So
Yeah.
I truly hope that, we see in the next 5 to 10 years that really beautiful amalgamation of the two industries, right? That Western medicine and the holistic preventative style of eating and lifestyle factors that can be joined together to really give clients and patients the best outlook on life.
Yeah, absolutely. And it's easy, right? It's easy to prescribe a pill. I can get a patient in and out, having a conversation about everything they eat and don't eat. And if you're at this restaurant, choose this. That takes months or years to learn. And I think I was interested in diet early in college, and I went through a pretty strong Michael Pollan phase where I
Oh,
read all
nice.
sorts of, yeah. And what was the book? An Eater's Manifesto. Is that the
Yes.
shorter
Yeah.
one? Gosh, it's been 20 years since I read that book, but really kind of super quick read, great summary of kind of how the Americanized Western diet came to be and what the problems with it are, why cuisine exists in the first place, and how you should eat. And it's like super simple, the guidelines. And I kind of took that to heart. And I tell my patients, don't diet, find a lifestyle. If you have to think about cutting things out, you're doing it wrong. You should be eating what you want. You have to train yourself to eat that way. It'll take years, but get there and start now.
Absolutely. Yeah, I think it's important, right? Is if you want to be healthy, and even like in the world of skin health, and I can assume that you being a plastic surgeon and doing these surgeries, what your clients are eating afterwards can really help improve the outcomes of the surgeries they've had.
Absolutely. I mean, if you come to me for a tummy tuck, and I always tell patients they should be at their goal weight. I don't care what your goal weight is, but it should be one that you are happy with, because if you've lost a bunch of weight and we do a big surgery, a permanent surgery on you, and then you gain weight, you're not going to be happy with your results. If you are overweight and you're not happy with your body, surgery isn't necessarily going to fix that. There's no on my end, there's no surgery for weight loss. Bariatric surgeons do it. Plastic surgery is not a good option for weight loss. I can make your shape better sometimes if that's what you want, but if you then have your surgery and lose a bunch of weight, it's bad. And then some patients are very concerned about their weight, and I tell them, okay, you have 6 weeks where you can't do strenuous exercise, you can't do heavy lifting, and it's very hard during the recovery phase because you're going to gain weight. You're going to, if you are on a strict exerciser and that's how you control everything, you're going to gain weight. If you're a strict dieter and I'm telling you, you have to be more sedentary and maybe you start eating more calories, or worse, don't eat the calories, and now you're not going to heal. So I talk about that a lot because it's so important to maintain homeostasis and make sure you have the amount of nutrients and calories going in that your body needs when you're in the healing phase. And if you're not prepared for surgery, you're not going to be happy afterwards.
I think this is a really refreshing conversation to have, especially in this virtual world that we live in. And you do see some of these really like big name plastic surgeons that are, they don't talk about these things. They're talking about, what we can do to, maybe we'll put filler here, we'll put Botox here, maybe we can do a facelift. You can get this, you can get that. And they're always talking about the ways to improve, but they're never talking about these aspects. So I really appreciate the perspective that you're bringing.
Yeah, absolutely. These are the conversations I have with patients all the time, because it's tough. You're paying for a service, and you're paying quite handsomely for a service because it's expensive.
And it's almost like you need to have those lifestyle and diet factors in place before you decide to make these changes, because I always like to say we live in this Amazon Prime society where we want everything today. Like we want Uber Eats today, we want our Prime, we want all of it. And it's really taken away that component of putting a little extra work into it, right? Putting that, changing the way you're eating and making those challenges. It's like we live in a society that wants to take every challenge of life away, but in reality, it's not the right method. Like really having that foundation before you choose to maybe go this route is important.
Yeah, absolutely.
And Chris, I would love to know, because you've been a little quiet today. You're not usually
Because you
this.
don't give me a chance.
Okay, I'm gonna let
You
I'm
ju-
gonna
you
let
ju-
you have
you
a
just
chance.
you just
She's
television
kind of a
yourself.
bully, isn't she?
Yeah,
I am a bully. I know.
she
You wanna?
is.
I'm gonna let you
And
ask a couple questions,
if she
Chris.
gives you a gold star, Dr. Aaron, I'm just gonna let you know I'm just gonna take it away. So I might as well just.
I won't
You
take
get a
Dr.
gold
Aaron's
star
credit.
anyway. You can have mine.
See, that's why we like Dr. Aaron. So Chris, I'd love to know. I'll let you ask a couple questions now, because I have been hogging the conversation.
Actually, I just wanted to contribute and just to see, because we're really big on nutrition as well as lifestyle. We use some supplements, these types of things.
Yeah.
What people tend to fail, or the connection, and you might see this in your practice, is that the stress component is massive, right? So if someone's struggling emotionally, mentally, like you were
Yeah.
saying, surgery is trauma. The
Mm-hmm.
body does not know how to perceive it other than a car accident, other than
Yeah.
it been exposed. So I have this analogy, and I say stress equals inflammation. Inflammation equals signs and symptoms. So that's, when we're seeing things like the acne or the eczema or whatever, psoriasis.
Mm-hmm.
And then from there, disease, disorder, and illness. So if somebody comes into your practice and they're high stress and they've had some catastrophic things happen in their life, well, chances are we're going to see some inflammation. So do you see that if they don't make some changes like you're suggesting prior to the surgery, that inflammation can also, one, hold as weight, just so everybody can understand that, because it's not so much that you're gaining weight, but the body's just trying to fuse everything together and saying,
Yeah.
hey, what's going on here? But do you see that the people that really truly invest the time ahead of the surgery and take your recommendations, come back, don't speed through it because they have to have that, the perky boobs and the beautiful lips and everything, and they take your advice, that their healing is faster? Now, granted, caveat here, we don't know what they had coming in. I'm just saying as a whole.
Yeah. That's you were so right with surgery is trauma. I tell my patients, you and I know that you are getting operated on because you want to be, or you have to be. You know that you had a surgery. Your body has no idea. It thinks it was attacked by a wild animal.
Mm-hmm.
So breast cancer patients come to me and they are going through so much emotional roller coastering because their first diagnosis is awful. Then they hear from their breast surgeon and they have a plan. You feel better. Then you talk to me and hopefully you feel better. Some people don't. But I tell them, you have a team of physicians and nurses and care providers whose goal is to get rid of your cancer and keep it from coming back. My job is to help you feel better about that process. And I talk to them about, day one after surgery, you're going to feel great. All your endorphins are going high because you just got attacked by me and this other surgeon, and your body's producing endorphins. And you've got pain meds in, you've got the other medications we gave you, and you're going to feel really good. Day two, you'll feel good. By day four, your body has been holding on to all this water weight to help increase your blood pressure. It's going to start jettisoning it. You're going to start peeing a lot. You're going to start feeling depressed because now you're basically captive in your own home because I took away your freedom to do the things you normally do. And in the Pacific Northwest, I mean, especially if it's nice out, like, I had to be very clear with people. You can go for a walk, but you have to walk like a Southerner. You can saunter. You can't hike. Because patients will do that. And as far as being ready for surgery, I think 100%, when you have your ducks in a row and you've sought out the counseling and you got involved with a support group, I think I bring breast cancer patients because that's the most kind of drastic and the biggest support group that is most streamlined. They do better. Their navigation through the process is easier because they kind of have an idea of what to expect. They've seen people go through it who they're like, there is light at the end of the tunnel. I can't see it, but my friend told me there is. And same with aesthetic surgery, or even filler. I mean, your first couple days after getting filler, sometimes your lips can get real big. You go home and you're like, I made a mistake. This is awful. I just did my sister-in-law's filler. She's out here visiting, and the whole night she was just like going like this.
Patting
I've
her
done it in the
lips.
past, but she was like, "What did I do? This is weird. I don't like my lips right now." And then day 2, she's like, "Oh, I love this." Um, but if you don't have that kind of mental preparation for it, it can be very hard to go through. And just like you said, I mean, if you're anxious or stressed, we all have behaviors that we do when we're stressed to kind of calm ourselves down. So you're stressed out now. You're locked in healthy diet. You're eating potato chips or scalloped potatoes, out of a box, which
I
I
used to
heard someone had a
crush.
problem with.
Yeah,
Yeah.
you've clearly listened to the podcast. I was like, whoa, like that's really specific because that's me. That was absolutely me. You're
Yeah.
clearly listening.
So it's kind of a domino effect, but if you come in and you're prepared and you've done your research, and I mean, a consult with me is an hour of information exchange.
Wow.
I'm learning about you, you're learning about me. I try to impart, all of my knowledge into this time to get you ready as possible, but you'll never remember everything. And that's why I meet with every patient at least 1 or 2 more times before surgery, because you walk out the door and you have 10 questions, especially men. We are the worst,
We both have
every time
husbands, so we know.
yeah,
We agree.
every time I have a male patient and they bring their wife back, the wife is like, these are the 18 questions he didn't ask, and let's go through them one by one. And I love that.
I love that.
But
That's
men are
hilarious.
like, yeah, we're good. Let's move on.
We're fine. Let's go.
Yeah.
That's too funny. Yeah, I gotta love a wife going in to ask all the questions the husband forgot, because that would definitely be me. So I really, like I said, I find this perspective really refreshing. The fact that you're spending so much time with your clients, you're educating them, because I feel like a lot of that, especially in the world that we work in, right? A lot of our acne clients, they don't get doctors that spend time asking them questions, that spend time getting to know them. The majority of our clients, they go in, they see their doctor for less than 5 minutes, they're just given a prescription and they're rushed out the door, which
Yeah.
is so disheartening. So I really love to see this perspective that you're actually spending time and you're caring about your patients and the outcomes that they're having and answering those questions that you have. Because Chris, we see this every single day with our clients, unfortunately.
All the time.
Yeah.
I see it with my daughters.
Mm.
So I have reminded me, just in case you don't know, Mom, my birthday's in 13 days.
Yes, you got a teenager.
No, I
right
don't
there.
remember that traumatic behavior
No,
all
you
that
don't-
day.
You don't remind going through childbirth at all.
Right? But I have 12, I have 14, and I have 16.
Wow.
And, I can't believe I've watched in the last couple months how makeup has become even thicker. And I need a bronzer, and I need this red stick. Don't even ask me what the red stick is, because apparently it's not lipstick. But this red stick just takes away everything. It's like a magic stick.
Chris, come on, a color correcting stick. Let's get real.
Okay.
You can see how Chris and I are in two
it
opposite
stresses
ends of
me.
the spectrum.
No. Oh my gosh. We always are those. So, but
We
we
always
agree
are.
on this nutrition. However, I watch them and I see it and I morph, and they show me this video where somebody literally just put, I don't know, what do I call it? Like concealer or
Liquid, the liquid foundation. They drip it down.
Foundation,
There you
and
go.
they dripped it down. And this person would, like you said, doctor, and they would have said, where did you get your surgery from? Because this person didn't even look like the same. Their nose was concert. And that's amazing that makeup can do that. But a cool fact is we have more millennials now than anybody else.
The millennials are really
The
right
millennials
now.
have the baby boomer, their tail ending, right? That was the biggest.
Us millennials are in here.
And I look at my kids, and gosh, I love them. And I'm like, okay, you're beautiful. And they're like, well, you have to say that because you're my mom. Well, no, I don't. If you know me, I wouldn't say that. However, my concern is they're growing up in this exact world where, and I said, why do you do that? Because I'm ugly. Because no, actually I got it because you made me ugly.
Oh, that's
And I said, you just called your mother ugly, right? No, I didn't. But that's
teenage
what
girls, teenage girls.
That's the body morphia I'm seeing starting young. And my 12-year-old's in there with a skincare routine. I gotta love it. But my gosh, before she needs 30 minutes before she goes to bed, because she needs to put on this butter and that this thing. but that's what concerns me is
The body
this,
dysmorphia that's coming through.
is the body, and I'm sure they'll grow out of it because I'm like a jogging pants kind of gal and got them on now, just letting you know. But it's the society of it. They're going to start watching those TikToks and those reels where it comes to Botox and it comes to augmentation. And it only takes them to be in that moment of mental, I'm going to say mental instability, as in like they're just not feeling good. They're teens, right? Like that's what I call like the aliens in their body.
Yeah.
The teens.
It takes that moment for somebody to come in and do that nasty comment, and they live with that. And then they come to you and you're like, well, right? So I love that you're taking that time to massage that.
Yeah. I do have a tangent I want to add to this, Dr. Aaron. I'm quite curious. I know you said obviously you're not a psychiatrist, being a plastic surgeon, but do you have any, tips or recommendations for like not just the teenagers, because millennials have these body dysmorphia issues as well. We see it daily with our clients. Do you have any tips and recommendations for how you can kind of like bolster yourself from this onslaught of what society feels is beautiful?
That's a great question. I think disconnecting from sources that cause that is probably your first go-to. I mean, I've seen some makeup tutorials, and because for a while there was a trend where they were doing like, oh, I'm really ugly, and then I put up on makeup and I look like this model. It is
wild,
mind-blowing.
It is. They don't even look like the same person.
Yeah.
Oh my gosh, I know.
And a lot of it is lighting and camera angles and things like that, which we've been doing for years. But seeing that, and I don't internalize it because I don't wear makeup. So I'm like, oh, that's a cool trick. But if I was a female and I felt at all insecure about my appearance, or as a male and I felt insecure about my appearance, which we all do, then that would be that much more devastating to see that and being like, oh my gosh, I have to run to Sephora right now and get all of the things, or whatever the cool makeup brand is. I don't know, but
you were close for the store, but you got there.
Yeah, well, they have makeup, so
they have makeup. They do.
Yeah.
Oh yeah, they do.
Yeah. So I think cutting the source out of that. I mean, I use Instagram. I post pictures of society's pretty people on my Instagram. I contribute to that pool. I try to use pictures of people that are a little more natural looking than completely overdone or unobtainably beautiful. Cutting that out, reaching to friends and family that you engage with on a good level, not like toxic Becky, who is really into the skincare thing or beauty market, or you perform less than healthy activities with, whatever your lifestyle you view as healthy is. Stay away from toxic Becky. Go to your sister who actually does love you, and she's probably going to tell you the truth, or a friend who is a little more honest with you, and maybe they'll be like, yeah, honestly, you are kind of ugly because of this, but this is something that is beautiful about you, and work with them and identify those things. And everyone has their ugliness. Maybe it's your attitude. Maybe you've got an eyebrow you don't like. It's not a problem. Just realize what it is and work with it and celebrate it if it's a characteristic that you can. And there are a lot of people with really bad deformities that are beautiful people, and you wouldn't even like, you probably have a friend that has something that is considered ugly and you wouldn't even think about it. It never even crosses your mind. A lot of the breast cancer patients who have to go through a transition sometimes with no breasts. I have spent many hours sitting there with crying patients. I'm ugly. My husband doesn't find me beautiful anymore. I don't feel like a woman anymore. And we're getting there. We have end goal, but it takes a while. It takes months sometimes, depending on how they're healing. And I bring the husbands in, and they're like, I don't feel that way. But their partner, who is probably the most honest person with them, the woman doesn't believe, because they feel like they have to say that, just like your daughter, and you're being honest with them. And at the same time, I challenge my patients, okay, go to the grocery store. Tell me how many women there don't have breasts. And they're like, well, I, I don't know. And I'm like, exactly. They don't know either. The checkout person didn't know if you had breasts or not. They were worrying about, why is she buying these weird things? Like, they're not thinking about that. Or maybe they're thinking, I can't wait to go home. People don't care. You go through your life. You're not being judged constantly. Um, so I think reframing your internal stimuli and external stimuli, and getting a good solid base of healthy people around you mentally and physically can really help change your perspective, and the people that have kind of dysmorphia. And then professional help, going to a therapist. I mean, I can't stress that enough for my patients. Like, go to someone who doesn't know you, who isn't part of your life, who has a third party objective. Even if it's 2 sessions, those might be transformative. It might even open your eyes to a whole nother world of, oh, this is what's causing my thing, because they're coming at it from a completely different angle. So don't, toxic Becky is not the person you should tell your problems to. Get a professional opinion. They're trained in helping you with this. Becky just watched an Instagram video. I'm sorry for anyone that's named Becky on the.
I know, it's like these key names. I just get like the Karens and the Beckys. I'm like, you feel sorry. I'm like, how did we as society pick these poor people's names? It's like, again, another part of that society. But I think what you said was really interesting, right? Is like, even I myself, I have so many insecurities and flaws, and I talk to my husband about them, and he's like, I don't know. He's like, first of all, you need to stop watching reality shows, because like, it's just unattainable. And I see it myself, where like, being in the role that I am and knowing the things that I do and doing what I do, I am a confident person, but even me, when I'm watching these reality shows and scrolling Instagram, it makes me feel bad about myself. And I'm like, oh my God, well, I don't have a perfectly flat tummy. Maybe maybe I need to get cool sculpting done. I don't have this. And and then I catch myself. I'm like, whoa, Katie, like, come on now. You're watching these people that have been surgically enhanced, and it's almost like that natural beauty has almost gone out the window. And it's so unfortunate, because we're looking at these people that are put on a pedestal as being beautiful, but they've been so surgically enhanced, and they're not I don't want to say they're not a normal person, but it's not a natural look. And I don't know if I'm explaining this how I'm trying to get out of my brain, but we're all after this unattainable beauty that has been surgically enhanced. And we all sometimes forget that they're like, oh my God, that person's so much more beautiful. Well, they've had a lot of work done. They've had their nose changed. They've had breast implants. They've done this, they've done that. And I think it really plays on that psyche of an individual when you're seeing this day in and day out.
I mean, it's been a thing as long as we've had pictures. In the 80s, we obviously had pictures for the 80s, but airbrushing was a huge thing in magazines. It was a huge scandal on 60 Minutes. Someone had airbrushed someone and they got caught doing it. And Photoshop, it's so easy to change body proportions and things like that, and people get in trouble all the time. We're just like, oh yeah, whatever. Apple, I don't know, it was one of the iPhones, 7, 8, 9, 10, around there, where they built into their portrait mode a filter to help with skin and complexion.
I remember.
Yeah, and some executive thought it was a good idea. Well, it's not. It shouldn't be turned on by default. Instagram filters, TikTok filters, your
Zoom filters. Like, they've Zoom filters now.
Yeah. So you are learning to internalize that as that's what people look like, and they don't. They're using technology to enhance that. Same with surgery. I mean, there's nothing wrong with if you are a healthy, well-informed individual about getting cosmetic surgery or reconstructive surgery. I had plastic surgery. I had some moles removed that bugged me for cosmetic reasons. It was just out of college, and I always hated them. I went to a plastic surgeon. I did not want to do plastic surgery at all. I thought I wanted to be the next Paul Farmer and do medicine abroad.
And you ended up in plastics.
Yeah. I actually didn't really care for my plastic surgeon. I thought he didn't spend any time with me. It was like kind of a waste of his time to do this. So I felt the entire time. Am I happy with my results? Not really, looking at how the scar spread, but a lot of that was on me because I was still playing rugby at the time, and I was like, that's good enough, and it'll heal. And I
Such a
didn't
dude
follow his,
mentality.
yeah, didn't follow his instructions at all. So part of it's on him, part of it's on me.
Hmm.
Doesn't really matter. But anyway, that was a huge turning point for me that I think back on years later as I'm like these scars a lot better than the big mole I had
Right.
there. And for whatever reason, made me feel more self-confident. And it's such a
Hmm.
small thing, you
Right.
know?
And I can appreciate that perspective as well. Cause for me, I have a cleft chin and it's something I've had since I was born, obviously. And I've been made fun of consistently throughout my life. And I remember being like 8, 9 years old, wishing I could just like shave it off and fix it myself because I was so self-conscious. Thank God I
Yeah.
didn't do that. And for me, and not only is a self-conscious component, but there's another personal reason that I don't wish to share, but there are reasons why for the last, majority of my life, I wanted to have a reconstructive surgery for my chin because it's cleft and it makes me feel very, very self-conscious about it. So I can
Mhm.
really appreciate that perspective of it's not that I'm wanting to go and feel, more beautiful or I want this filler or I want that. It's something that I'm very, very insecure about that I'm sharing with,
Yeah.
thousands of people right now. So it's giving me anxiety, but it's fine. So I really appreciate that perspective of it's on that line of making someone feel better about themselves, but not preying on the vanity component.
Yeah. It and it's I use this example a lot, and I don't know their names. Jessica Chastain and Jennifer
Right.
Garner have
Right.
very masculine, strong jaws.
Hmm.
Madonna has a huge gap between her teeth. And a normal person with a gap between their teeth is not considered. If, no one says, "Oh, please." Well, maybe people do, but you're not like, "I want a gap between my teeth." That's beautiful. But Madonna owned that. Females with strong jaws own that, and it's made its way into that. That's beautiful.
Hmm.
Your chin, I notice it. It's beautiful. It brings
Hmm.
a difference to you. It's like a beauty mark. It
Mhm.
it's more of a masculine feature, but that's great because it sets you apart. It gives you something, a frame to work with. And I think that's true of everyone. I mean, a lot of men have acne pitting on their skin.
Hmm.
And I remember thinking, um, it's like that kind of rough, uneven surface kind of enhances that idea of masculinity because it kind of has a weathered or strong look, like someone who's worked out in the sun. Um, and it may be just something I've associated with it. There are stars with acne pitting, and they're huge, and they're not ugly, they're not beautiful. It's just that's their look,
Hmm.
and that's fine. And they're literally, making millions of dollars selling their physical appearance to you in a theater.
Hmm.
Um, if they can do it, what's wrong with your scarring or hitting or clefting? You know?
It's this world of perfection that we live in, I think, and it's just so unattainable for us to think we have to be perfect in every single way.
Yeah.
And we're coming up to the 40-minute mark, so I want to make sure that we make sure to get in this world of Botox that we're
Oh
really
yeah.
really
She's just
really
ripping the Band-Aid off now.
I know.
No.
Yeah. So, and we go into this. Listen, Chris and I are going to take the stance of Switzerland on Botox because, like I said,
Okay.
it's a very heated debate. But we would be amiss if we didn't discuss this in the world that we live in because we get clients asking about Botox, and it's so prevalent. And you see it. You see reels of women getting Botox on Instagram and men as well. So, could you just share a little bit about really what, like, I want to know what is Botox? Let's talk about how Botox is that catch-all term for many different types of injectables, and really what are like the pros and cons, because Chris and I really always like to take the stance of giving our audience and our clients information on both spectrums so
Mhm.
they have the education and they can make the best decision for themselves at the end of the day. Because if someone's getting a breast augmentation or filler or Botox, that's not going to impact me, and I would never want to judge somebody for making a decision for themselves that is going to make them
Mhm.
feel better. So could you kind of just break this whole world down a little bit better for us?
Oh yeah. I'll just take this entire
Yeah, the
thing and condense it
entire
into 10 minutes.
society we
Um,
live in.
Yeah, so Botox is interesting, right? Because it's probably the most well-known, easily accessible thing in plastic surgery.
It
Probably. I'll have to
Well,
think
it's
about that.
everywhere.
But
Like, I live
yeah,
in a small little town, like super small little town, and there's probably like 6 places you can get Botox.
yes, which is good and bad.
Yeah, good
Um,
and bad.
eh, I'll try not to get on the tangent of training because it's something I'm very passionate about and who should be and who shouldn't be injecting. But
Mhm.
there are a lot of people that legally are not allowed to inject Botox, but they're doing it. So be careful.
Interesting.
Um, Botox basically it's a drug. It's derived from Clostridium botulinum, which is the reason you don't give little kids honey because it can have botulin toxin in it, and that's not good for children. Botox is contraindicated in children because they're more sensitive to it. It is used in some kids for dystonias and things like that. Botox was originally found and used to, again, it's a toxin. It interrupts acetylcholine and makes it so muscles don't fire in the normal way. It either weakens them or paralyzes them. And it was originally used in a way to help people with migraines or um, muscle spasms for therapeutic reasons. And I don't know if it was a neurologist or an ophthalmologist who was injecting it around the eyes and noticed that people were not getting the frown lines, the 11 lines, that mad look. And kind of caught on. They started using it cosmetically. Got kind of a bad rap because people were getting these like dead faces. They were putting it everywhere, and they still do. Um, it's FDA approved in a couple areas, depending on which drug. They're all basically the same thing. You know, so it got FDA approved for the glabella. I think was the first indication, and not till 2002. So it hasn't been on the cosmetic market that long.
Like 22 years, everybody. That's not that long. Like, I remember what I was doing in 2002.
Yeah, listening to Britney Spears and
Absolutely. The Backstreet Boys, of course. Yeah, absolutely. I was.
um, so it's a drug. Oxygen is a drug. Saline is a drug. Vitamin infusions can be deadly. You know, a lot of things that we feel like are holistic and safe, if done in an inappropriate way, are not safe. And Botox, tox is in the name. It is a toxin. The industry is trying to get away from the word tox because it doesn't sound inviting. You know, it sounds dangerous. It is. It's a drug. They're calling it more of a neuromodulator is kind of the idea. And that's really the way to think about it. You're using something to target muscle groups in different parts of the body. It's mainly used in the face in the aesthetic realm. And the way it works is it relaxes your muscles of expression. So the big ones being the corrugators, your orbicularis oris, which is the muscle around your eye that causes the crinkling on the sides, or your frontalis muscle, which is the muscle that raises your eyebrows and creates those horrible, nasty wrinkles across your forehead that everyone thinks are bad.
Everyone, because like, oh my God, the fine line. Oh my God, I
Yeah.
have a fine line. I'm aging.
So it doesn't fill those in. It doesn't make them better. What it does is it makes it so you can't produce them as well. And again, my aesthetic is a light Botox and you know a little bit of movement, so you're more natural, but it's softer. So I tend to underdose, and I dose more frequently to kind of keep you in that level. It requires more input from a patient and more effort, but you can also do more Botox and get a stronger effect where you just have no movement, and that's not my aesthetic. But if the patient wants that, we'll have a conversation about what it does and how to navigate it, and I'll do it, but with the understanding that um, more isn't always better in my eyes, but it's up to the patient. As long as they're doing it safe and we're not doing a weird injection into a weird spot or um, a crazy dose that is unsafe. I mean, Botox, when we were kind of preparing, you brought up like the black box warning, right?
Mm-hmm.
The worst thing one of the worst things the FDA can do with a drug on the market is give it a black box warning. That means there are horrible consequences with this drug. And the black box warning for this is because there is the theory that it can travel systemically and you can have botulinum toxin systemically, which as you can imagine no big deal if you make your frontalis muscle a little weak and you don't have wrinkles. It's a really big deal if your diaphragm doesn't work or your arm doesn't work. Not good.
Not good. Yeah.
So
I'd like my arms to work.
yeah,
Yeah.
and according to the package insert, because I wanted to like go back to the actual box, I picked up a box in my office and I went through it. There has not been a case of that happening in doses. They don't talk about every dose, but they say in, kind of the cosmetic dose range of 20 to 100 unit dose range, they don't report it. I found a study out of Beijing where they had 89 patients with botulinum-like symptoms after receiving Botox. The study wasn't great, but it was informative. I wrote some numbers down so I could remember. It was 86, excuse me. And over 85% of those patients had injections over 100 units, some up to 300 or 400 units. And they,
Wow.
where did I say they got them? So the majority of patients received them in beauty salons. I don't know if that's a translation into like a med spa or they legit mean beauty salons.
Like getting your nails done, getting some Botox in there.
Yeah. Typically, the person doing your nails should not be giving you drugs.
I would hope not. Yeah.
Yeah.
Yeah. I go to my
make
nail
it a
ladies
lot
for my nails.
easier. A lot easier.
Less trips,
Yeah.
but yeah, I think the medical professionals is where you should stick to anything injecting into your skin.
Wow.
As someone who has done it as much training as you can do, I think I've done as much. I did 9 years of residency after 4 years of medical school, after 4 years of college. So a lot of training. I fully believe in being overqualified to do things. The nail salon person is not the person to give you your Botox.
No.
Unless they happen to be a plastic surgeon who really likes doing nails and has a nail salon business on the side. That's fine.
Yeah, the side hustle.
Yeah.
Yeah, plastic surgeons definitely need a side hustle.
But yeah, it's a drug. It works wonders for people with TMJ or neck spasms.
Migraines, people get it from migraines, right?
Yeah. And there's actually some really interesting links in patients with depression. I'm not saying that if you're depressed, you should get Botox. You should do all of the normal routes.
Right.
Exercise, diet, talk to a psychiatrist, talk to a therapist. But people who are getting Botox in their glabella were showing decreased signs of depression or decreased feelings of depression. And the main thought for how that works is there's a feedback loop between the way you express on your face and how you feel. So if you're unable to make those frowny faces, it kind of interrupts a little bit of that feedback loop. So
interesting. You
are then a little bit happier. Again, I'm not recommending this as a treatment. I'm just saying that some of the research has shown a link in that. That may not be the mechanism at all. And it may just be that people who are good enough to go out and get Botox are more likely to feel better in general. I don't know the actual link, but we think of Botox as this vain, a marker of vanity in society. And who would ever get Botox? You're so vain. You're putting a bad chemical in your body. We ingest bad chemicals all the time for different purposes. Aspirin is a bad chemical. And I saw a meme a couple months ago and I love it. It says, it's like a woman who says, hey, doctor, I'm 37. Is this Botox going to make me look like I'm 27? And the physician says, no, you're going to look like all the other 37-year-olds that are getting Botox.
I've seen that one. I laughed really hard. I'm like, that's hilarious.
Yeah. And it's so appropriate. It's
so
become kind of a normal thing. Like if you're not getting Botox, you're not up with the times, you're ugly. And it's not true. Get Botox if you want it. I recommend it. I think Botox does a wonderful job for the majority of people of smoothing wrinkles and kind of giving you a youthful look. It wears off when done properly. There's very few side effects. Side effects that you can have are obviously paralysis of muscle. Sometimes Botox, or I keep using the word Botox, but a neuromodulator can travel to different areas around the face, and maybe you have more paralysis than you want. There's a muscle that helps lift the eyelid and there is a little pathway to that. So if you inject too close to that, you can have an eyelid droop on one side. Sometimes people will do it for the smile, and you can't use a straw or something like that if you have that. And so obviously there are bad things that can happen with Botox. For a lot of people, it's therapeutic. It makes them feel better about their youth. It's a very easy, quick thing that wears off on its own. So I will tell some patients they should get it, and I'll tell the same patient, well, maybe you shouldn't get it there, or you don't need it that much. And we have that discussion when they come in. They're like, I want my forehead to be flat. I don't want it to move. And I'm like, Julie, you're 67. Your brows are hanging a little low. I realize you do not like those wrinkles in your forehead, but if I put Botox in your forehead, your brows are going to be touching your eyelids because it's going to relax that muscle that you're holding your eyebrows up with. And you're not a candidate for this. And so some people, Botox is not the right choice depending on their facial features. So you guys can be Switzerland, but I guess I'm both the evil and the good side.
Which I think is important because you are a doctor. This is your scope of practice. This is what you do day in and day out. Chris and I don't do Botox. We're nutritionists, so don't come to a nutritionist for Botox either. And that's the reason why I really wanted you to have on, because a doctor can speak to both sides and again, provide that proper education. And that's why we really wanted to have you on, because you do give both sides of the education. You're not just going to go on, social media, like every woman needs to get Botox and you need to get all of these units and it needs to be frozen. Really providing that proper education so people can make that decision for themselves. And something you did talk on is that Botox has kind of become a name synonymous with those neuromodulators, correct? So there are other brands out there that aren't necessarily Botox. So could you talk a little bit about that?
Yeah. There are, I counted them, maybe there's 5 or 6 different companies, and they kind of come and go. They all have a slightly different chemical formulation. They all basically work the same way. In my mind, they're pretty interchangeable. Each company will say, no, we have the better one.
Of course.
I saw someone the other day on social media saying, I'm using this product because it has a peptide that will make your skin healthier. And maybe that company advertises that. I don't really see a big effect using that product on skin quality.
Marketing is what it is.
Yeah. Some people claim that Dysport, which is another brand, works better for them and Botox doesn't, or theoretically your body can have an immune reaction that is stronger to a certain segment within the Botox that may not be in another one. Botox is like the Kleenex of facial tissues. Someone says, go get a Kleenex. You know what they're talking about. They mean a facial tissue. We don't call them puffs for whatever reason. We call them Kleenex. So the company Abbey or Allergan is the first one to brand that. They all do something slightly different. There's one called Daxify that's out. It's by a company called Revance, which has great products, and their marketing is kind of, you do one injection every 6 months, so it lasts twice as long as Botox. Well, it's kind of a higher dose and it works slightly different. But again, some patients may not want that frozen look for that long, and I use Botox because then I don't have to worry about different dilutions and units, and I just don't like doing all the math and being like, oh, I'm using Dysport, I got to multiply by 3, or I'm using this, I got to divide by 2, because then it's a lot easier to mess things up.
It takes out that human error aspect, right?
Yeah, in my office it does. Other bigger offices go back and forth just fine. They have their system, but sometimes the nurse is helping me out and they're drawing it up, and I really don't want to ever have to tell a patient, I'm sorry, you need to come back because we mixed it as if it was this and I gave you this many units. I don't ever want to have a mistake. I mean, you're going to have mistakes in anything you do, but you do everything you can to set yourself up for success so you avoid those. But yeah, so I would say to most people, they're pretty much all the same. They're interchangeable. Talk to whoever's injecting you, get their opinion on why they chose that product. If you're concerned about how it's going to affect you, do a small dose. I mean, there's nothing wrong with going in. When you go to your hairdresser and they're like, we're going to chop off all your hair, you can tell them no.
Right.
You can say, I only want a little bit off. You can tell your facial plastic surgeon or whoever's doing your Botox, well, I just want to do microvella. And some people want to do just certain parts of their face. And I say, well, that isn't going to be complemented. It's actually going to make your expression weirder because we're going to be paralyzing a normal group. And I'll give my opinion. At the end of the day, it's your body, your choice. So you don't have to get it, but there's no harm in asking or talking to someone about it. And again, you may find that it takes away your headaches, or you feel better or more youthful, and it makes a big deal for you and your own lifestyle. Could be a great solution. Other people choose that they don't want that in their body, and that's totally fine. I don't like mayonnaise, so I don't eat it.
You know, I growing up, I also hated mayonnaise. I thought it was a little weird, so I can appreciate that perspective. Yeah. I have two last questions because I know we're getting up to the hour, and we've got a full hour with the doctor, which is so lovely for us. Last two questions here is the questions we get often from our clients is, if you are somebody who chooses to get Botox, will it atrophy the muscle? So if you stop getting it, then all of a sudden everything sags. And second question is, how impactful is it on the health of your liver and its ability to detoxify?
Those are great questions. Let me talk about the second one first. So in that study with the patients, 86 patients, and again, this is a study out of China. I don't know all the details about it. There's nothing wrong with studies out of China. A lot of amazing research out of China. But the paper itself was, they had some issues that were lost in translation. But they reported in those patients, they checked their liver enzymes and their kidney function, and they didn't see a significant decrease in either or an injury to either. The amounts of toxin or neuromodulator, I'll try to use that, are giving are so low that you're probably not hitting your liver or kidney that hard. But again, I can't speak to any direct study that has investigated that over a lifetime. And that's really hard to do because we know that alcohol impacts
other factors.
Function. Yeah, the food you eat, the amount of fat content and lipids in your diet affect your liver. Your fluid intake affects your kidney. A lot of things go into kidney and liver function. So it would be a very hard study to do.
Could you imagine finding a group of women that get Botox but don't drink wine for the rest of their life? Like, that would be kind of a hard study to do, I feel.
Yeah. You just have to make sure everyone drinks the same amount of wine. So,
right. Yeah.
Yeah.
It would be difficult.
That might be easier.
That might be easier. Everyone has to drink this X amount of wine so we can.
Yeah.
I love that.
How many people listening right now are like, wait, where's that study?
Yeah, I
Botox and wine. Hold on, what?
Yeah, I can do that. So yeah, and then the other component is, does it give long-term atrophy of the muscle where all of a sudden everything gets worse?
It's kind of the point. Kind of the point is to provide a little bit of, not necessarily atrophy, but decreased effect. So it's kind of the opposite of going to the gym. So if you're not working out your frontalis as much, if you're not working out your bicep as much, it's going to atrophy. If you're working out your bicep a lot, it's going to hypertrophy or get bigger. And that's why you go to the gym, to make your muscles bigger or to change your body composition or to be healthy. But the reason you do Botox is to minimize movement. So if you're not firing that, it will get smaller. It will have decreased volume. Some people get it in their traps. There's a Barbie Botox thing because Barbie has a long neck. So it atrophies the trapezius a little bit and doesn't bulk it because it's not firing. So eventually, when you stop doing Botox, it'll build itself back up. But the muscles you typically put Botox into are not muscles that, if they were gone, would cause facial sagging.
Interesting.
So the reason you do your forehead is so that it doesn't lift your eyebrows and smooths out your forehead. The reason you do between your eyebrows is so that you can't bring your eyebrows together and you can't frown. If someone said, okay, if you do 25 Botox treatments, you'll never be able to do that again, most people are like, cool, let me just do the 25th right now. We don't typically do things, we do the masseters to help alleviate TMJ and things like that. But most muscles of expression, like your smile, I'm not going to take out your risorius, because then you're going to look weird and have trouble smiling. So it won't necessarily cause any sort of weird facial drooping if you do it too much. Really, it'll atrophy the muscles that you probably don't want a lot of expression on. But at 3 months, it wears off, so they're going to build back. So the best regimen, if it's something you like, is go for 3 to 4 months and stay regular with it, because you'll have the most consistent results. And sometimes you can actually go down on your dose, which is nice, because then you're saving a little bit of money.
Mm-hmm. Amazing. Dr. Aaron, thank you so much for coming in today. It was a much more extensive talk than I anticipated it to be, but I think it was so wonderful because we touched on so many different areas of the plastic surgery world, and really provided a great amount of education for everybody listening. So Chris, any final questions that you have before we leave the doctor for the day?
When are you coming back? Like, I've got like 10 other episodes already playing in my head.
Well, yeah, I think that would be a lot of fun. But like maybe next time we'll give you a button so you can cut Katie off and just take over.
Oh, I think Mr. Dr. Aaron's my favorite guest.
I feel like I'm getting axed as a co-host here. Dr. Aaron's the new co-host of the Clear Skin Chronicles. I love it. Thank you so much, Dr. Aaron. Yeah. And as I mentioned, if you are in the Oregon area and you are in need of any type of plastic surgery, especially if you're looking for reconstruction and any of those areas, if you're going through breast cancer and things that can make you feel better, you can find Dr. Aaron at Gilson Plastic Surgery in Portland, Oregon. And we will make sure to include his socials in the show notes as well. So you can go in, follow him, and make sure you're following a doctor that's able to provide you with the right education when you need it. Thank you so much.
Yeah, thanks for having me.
Thanks for hanging out with us this week on the Clear Skin Chronicles. We'll see you next Wednesday with a brand new episode. Remember to subscribe to the show and drop us a review. Sending glowing vibes your way, Katie and Chris.